Hi everybody, thanks for coming. Happy Mother's Day. So heart disease is an important issue, and I'm really glad everyone's here to listen to me talk about it. For a long time it's been thought of as predominantly a man's disease, but as I hope to show you today, nothing could be further from the truth. It's a disease that kills 3.8 million women a year worldwide, and so we really need to find time in our daily lives to focus on this and do what we can to prevent it. Now, I don't have to tell you, that's easier said than done. Women these days are busier than ever. Most of us work full-time. We're also full-time wives, mothers, boo-boo kissers, confidants, friends. That doesn't leave very much time for anything else, as you well know. But as I hope to show you over the next 30 minutes or so, there's some compelling data out there that really shows that we need to focus on this and do what we can to minimize our risk of heart disease. So we'll start by just talking about what heart disease is in general, or to be more medically precise, what is cardiovascular disease? The heart is part of the circulatory system that includes all of the blood vessels in your entire body. So heart disease is not just something that involves one organ, it actually involves your entire body. I promise I'll keep the medical slides to a minimum, but I thought this was a really good visual aid to really talk about the process so that you guys can put more of a picture to the name. So what happens is you get fatty plaque buildup in the arteries in your entire body, which causes the blood vessels to narrow. These are the arteries going from your heart to narrow. And this can happen in any part of the body. If it happens in the heart, in the blood vessels supplying the heart with blood, it's called coronary artery disease. If it blocks off completely, that's how a heart attack happens. If it happens in the brain, it's called cerebrovascular disease. Once it blocks off completely, that's one of the ways a stroke can happen. It can also happen in your legs, your arms, really anywhere, and that's called peripheral arterial disease. And that also reduces blood to your other vital organs and can also cause lots of different problems there, leading to amputations and other things. So why should women in particular care? Well, because it's the leading cause of death worldwide, but also in the United States. We're all worried about cancer, who isn't? But if you actually look at this, 23% of deaths are due to heart disease alone, 22% are due to cancers. So more women die each year from heart disease than all cancers combined. If you add the 23% from heart disease to the 7% with stroke, 30% of women die from cardiovascular complications. And that's a big deal. That's 1 in 3 women. So really something that we need to do something about. And it turns out that this is the case at pretty much every age. Women are always more likely to die of heart disease, particularly after age 50. Why is that? What happens at around age 50 to women? Menopause, right? So it turns out that estrogen, the naturally produced estrogen in our bodies, is protective from heart disease. But after menopause, we no longer have this protection, and you can see that yellow line spikes straight up, so we have a pretty dramatic increase in cardiovascular problems after the age of 50. So, is it really a man's disease? No. As I've shown you, plenty of women face this, and we as doctors used to think the same. We used to think that a man is much more likely than a woman of the same age to have heart disease. Not so. That's only true if you're a premenopausal woman. In fact, it turns out that since about the mid-1980s, more women than men are dying of heart disease each year. Why is that? Well, because we've known about heart disease for a long time. We thought it was predominantly in men. We got good at diagnosing it in men, treating it, making them aware of it, making them focus on it. And we didn't really think that it was the case for women as much. Turns out that's not true. So now you can look at the blue line. Men are dying less often from heart disease. Women stay the same. So we're not doing very well where women are concerned, and we need to be better about this. Part of it is that women themselves weren't aware that this is such a problem. And that's part of this campaign, to make everybody aware that this is something that every woman is at risk for, and you guys need to help us focus on this and help that trend. Hopefully, in the next couple of decades, we can reverse that trend, and that red line will start to go down too. So as if we didn't know from real life, women are different. And this also holds true with respect to cardiovascular disease. Women are more likely to die suddenly of heart disease with no previous warning signs. Men are more likely to have anginal pain leading up to it, to sort of be diagnosed with heart disease beforehand. But women are more likely to just show up in the emergency room with a fatal heart attack. So underscores the need for us to really focus on this ahead of time and prevent this. Women also don't do as well with heart disease treatments as men, particularly because they're diagnosed later in life, and at that point, things are harder to control. A woman is also more likely to be debilitated than a man from a heart attack of the same size. Not entirely sure why this is. It may be because women are smaller. And heart disease is often unrecognized for much longer periods of time in women than men. Again, because of lack of awareness, but also because women present differently than men, and this is something we all need to be aware of. A couple of statistics that I thought were pretty sobering. 1 in 25 women will die of breast cancer. That's an issue we're all very aware of, and obviously everybody, wants to prevent this, and people are pretty good about getting themselves screened. 1 in 3 women will die of cardiovascular disease, so really a big issue. The rate of heart disease in women rises 2 to 3-fold after menopause, and the risk just keeps going up. And particularly African American and Hispanic women are at risk. So what can we do about this? And prevention is key. You guys know this isn't new information. You have to know about things ahead of time so that you can minimize your risk. Many women, most women, go to their OBGYN yearly, they get their pap smear, they get their mammogram, but far, far fewer are aware of this important issue and go get their heart checked. Hopefully, we can do something to reverse this trend. So now that you know how much of a problem this is, what can you do? First, you need to know the symptoms of a heart attack so that you can recognize them in yourself or somebody else around you. Know the risk factors in general, but particularly know your own risk factors and know what we can do to minimize them. This is where your little cards can come in handy. As we talk, I'll go through all the different risk factors, and the cards sort of have them listed out individually with little goals, with little stratifications to assign yourself a score. At some point later in the day or whenever, find some time to go through this and assess your own individual risk for heart disease. If you're at moderately or high risk, you should probably be seen and get checked out. Make sure that you're not at risk and start taking the appropriate steps to minimize your chances. So what are the heart attack warning signs? Well, as with men, women do have chest pain as their most presenting symptom, but that's very often not the case. The chest pain oftentimes, or can sometimes come on as an intense heart pain that's difficult to ignore, and people go to the emergency room. But more often, it starts out as a vague, tight, pulling, squeezing chest discomfort that people don't necessarily seek attention for immediately because they're not sure what's going on. This is, again, someplace where hopefully we can make an impact and get people seen sooner. Women, however, are more likely to present, more likely than men to present with symptoms other than chest discomfort. They're more likely to have jaw pain, neck pain, pain that involves one or both of their arms or their back, stomach. Typically, this is a pain that can get worse with exertion when you're trying to do something and sort of lays off when you rest. Important to recognize, you may or may not have chest pain at all. This can be your only presenting symptom. Very often comes on with sudden shortness of breath, break out into a cold, clammy sweat. Could also come along with some nausea, vomiting, dizziness. The spectrum really varies, but it's important to keep this in the back of your mind and get checked out if there's a problem. So if you or anybody you're with is having any of these symptoms, it's important that you know how to recognize them and call 911, get them checked out early. So what are the risk factors that I was alluding to? There's a few of them. Age, women greater than 55 and men older than 45 are at higher risk for heart disease. And I showed you that curve, that after about age 50, women's risk of heart disease really goes up. Your family history is important. First degree relatives, so your brothers, sisters, your parents is what puts you at risk. If you're If you have a male relative, first-degree relative, that had a heart attack or a stroke before the age of 55, or a female relative less than 65, that puts you at risk. Meaning that in addition to all the other lifestyle risks out there, you also have a genetic predisposition to forming heart disease, and this is often more difficult to treat. Now, smoking, we all know about that, that's a biggie. High blood pressure, obesity, diabetes, high cholesterol, and not being physically active. The first two are not something you can do anything about. You can't pick your family and you can't turn back time. But the other 5 are something that are called modifiable risk factors. You can change these. And that's what we're going to focus on. And that's really where we can focus on in our daily lives to be aware of this and try to minimize it. So the number 1 preventable risk factor in this country is smoking. Nicotine is just so bad for you on so many different levels, cancers, all kinds of things. But as it pertains to heart disease, 50% of heart attacks among women are due to smoking. It's kind of a crazy number. Women smokers tend to have a first heart attack 10 years earlier than non-smokers. They're also 4 to 6 times more likely to suffer a heart attack and have a stroke. And specifically, women who smoke and take birth control pills are at much higher risk. 30 times more likely to have heart disease. So what can you do? Quit. Easier said than done again. Lots of people try to quit, go back to smoking. There's different options out there, from any place from nicotine replacement products to non-nicotine medications that can help you quit, and then just designated programs to help support you also. I often see in my practice that people will stop smoking, but they're wearing a nicotine patch or chewing the Nicorette gum. And I just want to underscore the fact that it's not the smoking itself, it's the nicotine. So smoking is really bad for your lungs, but it's the nicotine that causes all of these problems. So nicotine in any way, shape, or form is bad. And really the goal should be getting rid of all nicotine products altogether. High blood pressure, it's called a silent killer because oftentimes you don't know that you have it. You can't feel any different with a blood pressure of 140, 150, or in the high 140s, 150. But down the line it causes damage. After age 65, more women than men will have high blood pressure, and African Americans are particularly at risk. And this is something that you can easily diagnose yourself. Anytime you go to a drugstore or a grocery store, oftentimes the pharmacies have those self-inflatable automatic blood pressure cuffs. Stick your arm in there, get your blood pressure checked. If the top number is over 140 and the bottom number is over 90, more often than not, you need to see somebody. What can you do yourself? Well, you can definitely start to make some lifestyle changes before really seeing medical care for it. Lose weight if you're overweight. Exercise regularly. Actually, it's interesting. If you put somebody on a treadmill, measure their blood pressure before they exercise. After they exercise and they're starting to recover, their blood pressure comes down to below what it was at rest. And this effect stays for a while. So exercise directly lowers your blood pressure. Avoid excessive alcohol. What does that mean? Well, the American Heart Association recommends no more than 1 alcoholic drink a day for women and no more than 2 for men. And no fair saving it up all week and then drinking 7 on the weekends. That's not okay. Also, decrease your salt intake. Salt is a huge contributor to keeping your blood pressure up. It pulls in water into your blood vessels and really increases your blood pressure. That's a big place where you can make some adjustments. If you eat out a lot, I can guarantee you your salt intake is significantly higher than it should be. I think the statistic is that someplace around 90% of foods on the menu that you can order in a restaurant already exceed your daily allowance of sodium. So that's quite an eye-opening fact. Finally, if you've tried what you can and your blood pressure is still high, talk to your doctor and get on some good meds. We can bring down your blood pressure. You can still continue to try to do it on your own, and as your blood pressure comes down, you can come off the medicines. I really want to debunk the myth that once you start a medicine, you can't come off it. That's not true. You can still make your own lifestyle changes, get healthier, and then hopefully you can come off the medications. Here's a biggie. Between our sedentary lifestyle, fast foods, and lots of snacks, the prevalence of obesity is really, it's an epidemic. Here you can see especially, where we're sort of at the heart of it, it's especially prevalent in the South and the Southwest. Southeast. Texas and the really dark red states, more than 30% of people are obese. That's a lot. We're not doing so much better here in Florida, 25 to 29%. So clearly it's a place that we need to make some changes. Why do we care about obesity? Well, it's directly linked to an increased risk of heart disease. The heavier you are, the more likely you are to die of heart disease. That's what those graphs show. So you can lose weight. You have to just really put your mind to it. I know it's hard, it's really difficult, and it's definitely hard to find time in the day. And oftentimes as you get older, you're limited by pain. In the end, as I tell a lot of my patients, it's a math problem. Calories in have to be less than calories out. So diet and exercise, that's really the best way to do it. Active women can reduce their risk of heart disease by up to 50%. That's a big number. If you've tried anything you can do, with your diet and exercise and you still can't lose the weight, there's surgical options out there now that are pretty safe and very effective. Again, you need to combine that with some healthy lifestyle changes though. Diabetes. As we all know, this is a big contributor to problems in this country for multiple reasons. It increases a woman's risk of heart disease by 3 to 7-fold, as opposed to just 2 to 3-fold in men. Diabetic women who smoke are at particularly high risk of having strokes, 84% higher chance than their non-smoking counterparts. And 2 out of 3 people with diabetes will die of cardiovascular complications. So diabetics really have to take good care of themselves from multiple perspectives. What can you do about your diabetes? You have to watch your diet. You have to exercise. Keep your weight under control. You take your medications. Very important. You need to use your glucometer. You need to know where your daily glucose are. Very important. You need to know what your hemoglobin A1C is. Don't just go to the doctor and rely on them to check it and tell you what to do. You should know what your hemoglobin A1C is, which is a measure of how well or how poorly controlled your diabetes is. And that way you know what your goal is, and you can use that as an extra inspiration to get down to your goal number. Keeping diabetes under control delays other complications, kidney and eye disease, nerve damage, so not just heart attacks and strokes, but just overall general well-being. Cholesterol is yet another problem that faces us very frequently. The higher your cholesterol, and this is particularly the bad cholesterol, and we'll get to that in just a second, the higher your risk of heart disease. So you're more likely to have high cholesterol if you have an unhealthy diet, if you have high blood pressure, if you smoke, if you're obese, diabetic, don't exercise, drink too much, or if you have a family history of it and you inherit it. So you can see I'm repeating myself a lot. A lot of this stuff is very intertwined. And that's why it's important to get at all these risk factors all at the same time. Very important for cholesterol, know your numbers, just like the diabetics that I asked to know their hemoglobin A1C. Get your cholesterol levels checked. Usually nowadays, most primary care doctors are very attuned to this and they'll check your cholesterol level as part of your routine visit, but I want you to know what your numbers are. And don't focus on the total cholesterol number, that's why I put it in small letters. Really what you need to focus on is the breakdown. The total number is misleading. You need to know what your LDL level is. That's the one that's bad. That's the one that causes the fatty plaque buildup in your arteries. Okay, so that's the bad cholesterol. HDL is your good cholesterol, so we want to have a high number of that. But really it's the LDL that really overpowers everything. What can you do about your cholesterol? Again, healthy diet, exercise, losing weight, doing all the right things that we all need to. And then if you still can't make a dent in it, typically I give my patients about 3 months to shape up and bring down their cholesterol with lifestyle modifications. If it's not enough, you need a cholesterol medicine, okay? Here I'll pause just for a second to also say a lot of people are very afraid of taking cholesterol medicines and they don't want to take them when they come to see me. I do give them their time and try to see if their numbers will come down, but in the end, They're very helpful and really help out a lot. So if your doctor suggests that you should take them, please do, and at least try to see if you can tolerate the treatment. Physical activity is a very important part of staying healthy. If you're physically inactive, that really increases your risk of cardiovascular disease. As I mentioned before, active women reduce their risk of heart attacks by 50%. So you need to exercise. And what's the recommended exercise? So the American Heart Association defines moderate to vigorous exercise as 30 minutes of cardiovascular exercise where you get your heart pumping a day on 4 or more days of the week. Okay, so that's 2 hours a week. You can probably squeeze that in somehow. It does require a lot of dedication and planning ahead of time, but it's important to do this. As we already went over, regular exercise will reduce your cholesterol, help control your blood pressure, your weight, but it can also reduce the risk of certain cancers. In addition to just helping you feel better overall and give you more energy, so it's an important thing to do. I think this just really underscores everything. What fits your busy schedule better? Exercising 1 hour a day or being dead 24 hours a day? So the common theme is, how do we reduce all of these risk factors? Don't smoke, stay active, exercise, maintain a healthy diet, eat a heart-healthy diet, and we'll touch on that in just a little bit. The DASH diet or Mediterranean diets are good options for people. Control your blood pressure, cholesterol. Take your medications, aspirin or fish oil if they're indicated. Talk to your doctor before you start doing it. I would not recommend just starting it. You need to make sure that there's nothing that should prevent you from taking it. So just to, as I keep telling you, have a healthy diet. Well, what does that mean? So, things to avoid. You know those yummy muffins we all had this morning? Yeah, that's a no-no. So pastries, danishes, any of that stuff is full of trans fats. It's actually really bad for you. Any high-fat dairy products, butter, full-fat sour cream, cream cheese, all kinds of cheese, whipped cream, anything that's with full fat, it's a fatty-laden food and typically should be avoided. Egg yolks, not so good. Eggs in general have been a controversy over the years, but now we think that the egg whites are good and egg yolks have a little too much cholesterol. Limit sugars, fried foods, red meats. If you're going to eat red meat, pork is the leaner red meat, and so if you really can't stay away from red meat in general, that's a healthier alternative. The heart-healthy things are skinless poultry and lean meats. Fish, very healthy. The recommendation is to eat fish at least twice a week. And although you wouldn't think it, the fatty fish are better. Salmon, tuna, mackerel, those kinds of fish, because they're rich in the omega-3 fatty acids that are very good for your heart. Low-fat dairy products, whole grain bread, cereals, pastas. Steam your food instead of frying it. Definitely the healthier way to go. If you're going to use oil, extra virgin or virgin olive oil is the way to go. It's not anywhere near as unhealthy for your heart. Excuse me. Other recommendations from the American Heart Association that you might have heard about: should you take an aspirin? Excuse me. Unlike men, an aspirin a day is not necessarily going to prevent a heart attack in women. So the recommendation is that diabetics or people that have had heart disease, strokes, or heart attacks do take a baby aspirin, which is the low dose, 81 milligrams a day. However, healthy women younger than 65 years old are not likely to benefit and actually are more likely to give themselves side effects. So should not take an aspirin on a daily basis. What about hormone replacement therapy? So before we talked about that after menopause, when you lose your natural estrogen, your risk of heart disease goes up. So the natural thought process was, well, if we replace this and we give you estrogen supplements, that should help. Turns out that's not the case. Hormone replacement therapy was actually found to increase your risk of strokes, heart attacks, and blood clots in older women. So we do not recommend that, and hormone replacement therapy should not be used to help prevent heart attacks. We do some, so in recent years we've shied away from prescribing hormone replacement therapy in general, but it's okay for healthy postmenopausal women sort of early in the, thank you. Early on in their perimenopausal years. We typically say for less than 5 years at a time is fine. What about other supplements? Folic acids and antioxidants like vitamin E, C, and beta-carotene. At one point or another were touted to be helpful for your heart. Studies have not shown this to be the case. They're certainly not going to hurt you. You can take a multivitamin a day, but there just hasn't been enough data to prove that it's helpful. Omega-3 fatty acids do have some data behind them, particularly if you already have a history of heart disease. They can be helpful, and especially they will help you lower triglycerides. The trick is that the over-the-counter fish oil supplements do not have enough of that active ingredient, the EPA, and so probably taking one of those a day isn't doing much for you. You would need a significant higher number. The prescription fish oil is really the only one that has the recommended number in it. So I hope that I've sort of highlighted how much of a problem this is, and that we're all affected by it in one way or another, whether directly or if it's a family member. And it's an important issue for us to focus on and add to our routine checklist every year of get your heart health screen, talk to your doctor about it, make sure that you're doing your best to minimize your risk factors. Thanks, everybody.